In the Human's test, we are checking for deep vein thrombosis, which is commonly known as blood clots. The patient must be in supine position on an elevated surface with the ankle in dorsiflexion. So you have to support the calcaneus with your left hand while squeezing the gastrocnemius, which is known as the calf muscle. So if the athlete complains of any pain, this could mean that you have a blood clot. For the Taylor tilt test, we're going to be checking for any tears in the calcaneofibular ligament, the deltoid ligament, and the anterior and posterior talofibular ligament. The patient must be sitting with legs hanging off the table to test for the ankle sprains. Hold the distal tibia and the calcaneus to invert and evert the athlete's ankle. If patient complains about the pain and you see extreme gapping, then that means that the test is positive and there's probably a tear. These are the range of motion tests. First, we're going to do active range of motion. That is when the athlete performs the movement on their own. First, she will plantar flex, dorsiflex, invert, and evert her ankle. The second one is passive range of motion. That's when the examiner performs the movement. The examiner will plantar flex, dorsiflex, invert, and evert the ankle without the athlete doing anything. The third one is resisted range of motion. That's when the examiner applies resistance as the athlete performs the movement. You should only do this if the athlete can perform the active range of motion and there is no fracture present or suspected. You will plantar flex, dorsiflex, invert, and evert while the athlete puts resistance. Next, we have strength training. First, we're going to have the patient walk. Next, we're going to have the patient go up on their toes. First, both feet together, then one foot at a time. Next, they're going to rock back on their heels. Then we're going to have the patient jog, progressing into a sprint. Then we will have the patient jog in a figure 8. Then in a Z pattern. Next, we'll have him hop with your feet together and then separately. And then any sport-specific skills, and since he plays basketball, we're gonna have him hop really high a few times just to get his muscles going. If there is any pain while he's doing any of this, there's something wrong.